Good morning, good afternoon, from wherever you are and across the world. We are really glad to join you this afternoon for a conversation on the new public health order for Africa, and really specifically on financing and investment opportunities in healthcare systems and infrastructure. It will be, I think, a really exciting panel discussion. We have a powerhouse of women who will talk to us about different financing and investment opportunities, and really concretely what that means for different sectors. So whether it's in health, whether for our member states, etc. So allow me to first introduce myself, and then I'll introduce our panel. My name is Lolem Gong, and I serve as the Chief of Staff at AMREF Health Africa. We are the largest international NGO headquartered on the African continent, and we've been around for close to 65 years, and we're really a one public health stop. Our activities range from typical public health interventions in every disease sector and also social enterprising. So we're extremely happy that to be asked to host this session today. And without further ado, I'll move right ahead to introduce your panel for today. Starting off with Dr. Anastasia Nyalita, who's the Chief Executive Officer of the Kenya Healthcare Federation, KHF. You'll hear us say KHF throughout. So that stands for the Kenya Healthcare Federation. And Dr. Nyalita could probably give us, when I call upon her for her first question or in her opening remarks, she'll speak just a little bit about KHF and some of the fantastic work that they do in collaborating with government, providing platforms for public-private partnerships and those sorts of collaborations. But Dr. Anastasia comes to us with a very solid background in business leadership, commercial operations, and technical operations. She's led and excelled in these roles throughout her tenures in several multinational pharmaceutical organizations across sub-Saharan Africa and Southeast Asia. Welcome to the panel, Dr. Anastasia.
Thank you.
And then next is Mrs. Azuka Okeke, who is the CEO of African Resource Center for Excellence in Supply Chain Management. She's based in Lagos, Nigeria, and oversees supply chain transformation projects in Nigeria, and has also supported other African countries in strengthening their health systems. And now more than ever, we need supply chain. We've seen some of the, just challenges we've had in vaccine distribution, and just really recognize our dependence on, our supply chain systems really being close to perfect. So we hope to learn from your expertise today. You're welcome to the panel.
Thank you very much.
And then next is Dr. Rispa Walumbay. Dr. Rispa Walumbay is a health policy advisor with AMREF Health Africa. So you get to have two of us today. And she's a global health specialist with over 7 years of experience in advocacy and healthcare policy at regional, national, and global levels. And she's really focused on healthcare policy and financing. And her work, the advancement of universal health coverage agenda. She currently is assisting on the AU Commission on COVID-19. This is the commission that is spearheaded by President Cyril Ramaphosa. So hopefully Rispa will share some nuggets from that conversation. Welcome, Rispa.
Thank you. Thank you so much, Lola.
And lastly is Dr. Jane Karonga, who is an economist with the UN Economic Affairs, UN Economic Commission for Africa, based in Addis Ababa, Ethiopia. Jane has been working very closely on the design of the AfCFTA, the Africa Free Trade Agreement, and Jane will be sharing with us today how this relates and this opens up investments in opportunities for investments in health. So thank you very much to our panel. Really glad that you accepted our invitation to be with us here today. I will go right ahead and start with Jane. And Jane, if you could please just share with us just sort of an overview of AFTCA. So what does AFTCA mean? How have you been working through different channels at ECA to strengthen the AFTCA? Why the AFTCA? And probably most importantly, what does it mean at this time, operating against this backdrop of the COVID pandemic? Over to you, Jane.
Thank you, Lorem. Thank you, colleagues, and good afternoon, good morning, and good evening, wherever you are. Thank you for your question. I'll start off by, as you have said, to give an overview of the AFCFTA. But let me also speak of ECA, where I work. We are essentially, we like to think of ourselves as a think tank for Africa. We promote economic and social development for Africa, and we essentially work with the African Union Commission and African Development Bank and the financial institutions on the continent and each one, leveraging on their respective mandates. Like we think of AUC as the political mandate, the African Development Bank, Afrexim Bank as the financial mandate, and we think of ourselves as the research mandate. So then we work with as the tripartite institutions to support economic and social development for Africa. So in that regard, I'm an economist. I work in regional integration section. And we are one of the sections that we've been working with AUC to formulate. We initially conducted some research understanding the challenges that the continent has, which in context, of course, things of unemployment, high level of unemployment, high level of poverty, and realizing that the demographic dividend, all the challenges of the continent is well known. And we wanted to figure out what kind of a framework that will address some of these challenges. And through our research, we recommended the African Continental Free Trade Area, which is essentially part of the African Development Agenda, the Abuja Treaty, all the way to the African Economic Commission for Africa. And if you look at that history, again, it's ECA from the beginning championing that kind of research. And then through the AU structures, we formulated to the point of adoption, and of course, where we are, ratification and implementation of the AFCFTA. And we work from a country, from member states, which is African member countries. We essentially work with them, do research with them, and look within their comparative advantage, what kind of comparative advantage they have, and how can they utilize the AFCFTA to achieve their development agenda. At continental level, we have, of course, the overarching agenda of the Agenda 2063. How can every continent achieve that, and how can they utilize the AFCFTA to achieve that Agenda 2063? And then you can then move on to the, of course, the global context of the SDG, because we are UN, of course, we are bound with the SDGs, Sustainable Development Agenda. And with that context, what do we mean by the AFCFTA? Essentially, with AFCFTA, which is African Continental Free Trade Area, we are talking of a free movement of goods, services, and business people. In the free movement of goods is up to 90%. That's what the member states have agreed on. And the services, we have various thematic areas of service that is being agreed on, and the negotiation is ongoing. And for business people, we are following the free movement architecture or agenda that is also ongoing and going through its own ratification. And what are we saying with this? When you look at the agenda in the FCFTA, we are essentially saying, we know African countries is 55 countries, and some of them are so small that they don't have the influence when it comes to talking to other partners. But if we can group and make it a single market of 1.3 billion, then we can utilize trade. Why trade? Because if you look at the theoretical aspect of trade, is where we are saying that if you trade, you manufacture, and then you trade, you have income. When you have income, then you essentially have choices. You can go to school, you can send your children to school, and then the GDP goes up, and then of course, poverty goes down. So that's the linkage essentially. And we are essentially saying, can Africa trade itself out of poverty? That's the way, trading out of itself poverty through the AFCFTA. And so with that, bringing the continent as one continent, saying, can it trade itself? How then within different sectors of economy, and one of them is health. If you look at health and how it can link to the FCFTA, before we even talk of any agenda, anything, if human capture, the people have to be healthy. If they are not healthy, and then of course nothing can come out of it. We know the context in terms of the health sector. Africa is high disease burden. We have a challenge. We import most of 97% of our pharmaceuticals at about 14.5 billion. At the same time, we say we don't have, but we can import. We don't have money, but we import. If we're importing, we are essentially not manufacturing. If you're not manufacturing, that means we are exporting our jobs. And then how can we then turn around and say we don't have jobs, our employment level is this? Essentially, we are not thinking through what needs to be done. So we needed to turn around the tables and say, wait a minute, how do we stop importing? Of course, it's manufacturing. And how can we use the CFTA? We know that when you're talking of manufacturing on the continent, in pharmaceuticals, it's a huge architecture. Then you come up things of regional centers for manufacturing, and how the AFCFTA then is essentially one single market. Then you look where within the region is a comparative advantage for specific areas where there's just maybe inputs, for example, and you develop a value chain around it. That's essentially why we are saying, how can we use AFCFTA to address the health challenges on the continent for the development of Africa, for the agenda that we want, for the Africa that we want. I'll stop here. Thank you.
Thank you, Jane. I don't think I've really heard this explained so comprehensively, and bringing it back to the health agenda. I do like the phrase, and really trading ourselves out of poverty. I mean, I think really that's probably the best and most succinct way to describe the AFTCA, and to think of just how that presents an opportunity for us to radically change investments in health, and to really change our health infrastructure. Because as you rightfully say, just as an example, we can't talk about, we pay 40 billion to import, and it absolutely begs this question on, then why can't we fund ourselves? I mean, I think that's a really pertinent question. I think in the next round, we would really love to hear from you on concretely then, what are those linkages that are being made between, this sort of trading ourselves out of poverty and the health agenda. As we know, most African countries have not met the Abuja commitment when looking at their health budget. Most of them have not reached the required 15%. So, what does that mean as we talk about trading ourselves out of poverty? So I'll just drop that there as a hint for the next round of questions. And in listening to you speak, I was just reminded that it was really important. It's actually important for me to just briefly give our audience a description on the new public health order for Africa. I mean, this is recent. It's really championed by the Africa Centers for Disease Control and Prevention. And this is one of probably the biggest agenda coming out of Africa's CDC this year. Of course, there have been rumblings of it since 2020, but really took on full speed this year. And its 4 pillars are really on partnerships, which we'll hear a bit about in a few minutes, on expanding manufacturing, which is really where I'm very interested in hearing, Jane, later on your views on AFTCA, manufacturing, etc., and strengthening our public health institutions. And then lastly, strengthening our public health workforce. And so when we talk about strengthening our public health workforce, I know later on Rispa will expand on this, but Rispa, in your current role, or one of your many tasks in supporting the AU Commission on COVID-19, I know that one of the 5 working groups is really on building back better, so social and economic recovery, and really looking at this new public health order for Africa. What is it? How do we dissect it? If you could share with us, just in general, where does this sit within the AU Commission on COVID? What drives it? And what are we hoping as, just the key outcomes? Over to you, Rispa.
Thank you, Lola. And I'm really actually excited from what Jane said. I think Jane gave a really great overview of, as you correctly said, I've never heard someone describe it so succinctly. So my role is I support the Secretariat, I support the head of the Secretariat at the AU Commission on COVID-19. And the African Union Commission on COVID-19 is, of course, chaired by His Excellency Cyril Ramaphosa. And he, of course, has been a really long-term champion in terms of helping us navigate our way through COVID-19 since it's, it's landing on the continent. And what the commission is really just, it's looked at the leaders and champions, global health experts across the continent who can really accelerate our progress in terms of making sure we learn from this pandemic, but also make sure we form sustainable strategies by, working together, collaborating together to, battle this pandemic and also prepare us for future pandemics and, of course, strengthen health systems. So the commission is divided into kind of like 5 groups, and those 5 groups are looking at different areas of creating resilience around our health systems. So the first group is, of course, as you said, is looking at Africa's recovery. And this is not just looking at it in terms of healthcare, it's also looking at it in terms of economic and social recovery. And that really, encompasses the challenges that we've seen, that when, health is affected, it is actually a cross-cutting issue, because it is affecting, the ability for people to learn, the ability for people to earn, and of course, eventually, of course, people's healthcare in the long term. So it's looking at strategies for how we can identify the strengths we had during this time. And I think one of the biggest strengths to be recognized from the Commission is our ability to work together. And I think that's why I was so excited by what Jane was mentioning, because I think this is the time when Africa has sat around the table together and tried to figure this out together. So the other Commission working groups, of course, look at vaccines and making sure we have access to efficacious vaccines. There's also access to diagnostics and therapeutics. And we also have a team working on gender and stigmatization. And then finally, of course, we have resource mobilization for the continent by the continent. So there's a lot of work going on around that. And as you can see, it's actually an all-rounded group, because we're focusing all of the different issues that would really push us in the right direction when it comes to recovering from this pandemic. So when it comes to looking at, Africa's recovery and what does that actually mean, it's really looking at how do we make sure that we learn from the lessons that we have seen over the past 1.5, almost 2 years. And part of those lessons are looking at things like commodity security. Part of that is looking at how do we engage in terms of the design of our national public health institutes, for instance, and how do we look at Africa CDC and strengthen the work of the Africa CDC in terms of really making sure that our health systems are actually working in collaboration with the Africa CDC in terms of making sure we navigate all these challenges we're having around access to surveillance data, making sure we can actually act effectively. And of course, all of this is anchored around the international health regulations from 2005. And of course, now, of course, there's a lot of conversation around what does this mean in terms of what the IHR was saying in 2005, is it still effective today? And so those are some of the conversations that we are looking at in terms of the African continent, because for a very long time, we were looked at, weren't really part of the conversation. We were the subject in some cases of the conversation, but we really weren't the drivers of the conversation in terms of directing where funds go, how funds are used. And of course, we've also been, I would say even the victim of vertical programs, because there've been serial investments in other areas that focused on vertical programming, which meant that health systems were consequently, weakened. And that meant that in terms of responding effectively to a pandemic, currently and in the future, these are some of the considerations we need to make. We need to make in terms of how do we invest effectively and how do we select the right investments. And I think that's why the new public health order summarizes, really key issues. So looking at the healthcare workforce, looking at national public health institutes, because as much as these pillars of the new public health order focus on a pandemic, they actually strengthen, they also it doesn't mean it's mutually exclusive for us to also invest in the health system. Because I think some of the conversations we've also had in the recovery group is to say that investments in global health security are actually not, they're not separate from investments in things like universal health coverage and healthcare systems. So we need to make sure that that's something that we understand in terms of moving forward. But I think that's just a general overview of like the conversation around Africa's recovery.
Thank you, Rispa. And so we'll come back to you in the second round of questions and really dive deeper now into I think for me, one of the pillars that has really been ignored, which is this investment in our workforce. Because I think when we talk about investments in health, as you put it, this question of that the new public health order seeks to address around how do we invest efficiently, right? And part of that is looking at our health workforce. In some cases, very much ignored. We just kind of hope it will happen. In some cases, there's been focus. So in the second round of questions, I would really like to come back to you and ask that you speak very specifically on how we can make those strategic investments in the health workforce. But for now, let me move to Dr. Anastasia. We've talked in general already about the AFTCA and the opportunity it presents. And then we've heard Rispa now talk about, just generally the new public health order and its goal to really push more efficient or more effective investments in health in all these different areas of health. And so really coming to you now to talk about, for an entity such as KHF, what does this concretely mean for you? What does this mean for some of the platforms that you provide other organizations within the federation? And what will this mean for just some of the private sector collaborations with government specific to health? Over to you, Dr. Anastasia.
Thank you, Lilem, and good morning, good afternoon, and evening, everyone, wherever you are. So my name is Dr. Anastasia Nalita, and I'm the CEO of Kenya Healthcare Federation. And I must say that at least in Kenya, the private sector is very well organized, right from the apex body, which is the Kenya Private Sector Alliance, KEPSA, which has organized itself along the sector boards that basically mirror the government agency. So that really eases at all, sectors. The platform provides a platform for the private sector to collaborate or have a dialogue with government, but also with other partners, whether they're in private or development partners. So Kenya Healthcare Federation is a health sector board of KEPSA. So we represent matters health at all levels especially in terms of advocacy. So for us, I think the most important, what we bring or the advantage we have is then in terms of partnerships. And when you're looking at the opportunities that Africa Continental Free Trade Area presents, it is basically really consolidating, the market into one huge market. And like Jane and Rispa have said, the opportunity also to have specialized, manufacturing centers, because manufacturing is one of the areas that, it's of interest and it's a focus for all countries, of course, arising from the experience we've had with how COVID-19 has disrupted the supply chain, but also how it has stretched the service delivery. I will talk about the partnerships in terms of actually some of the things that we are pursuing in Kenya. For example, we have special economic zones. And these economic zones present an opportunity for us to have pharmaceutical manufacturing parks. And most of them are government-led special economic zones, and some are private sector-led social economic zones. And therein lies the opportunity for public-private partnerships. So if you're investing in a government special economic zone, then the government provides the infrastructure, private sector comes in to invest. Now, the advantage of the pharmaceutical parks, and I know other countries like Ghana, Ethiopia, we already have experiences in a country like Egypt, is it's a one-stop shop. So in terms of investment, and you have shared facilities in terms of services, in terms of waste management, water treatment, you know, and you can even share facilities like laboratories. So if you're manufacturing a specialized product, then for you, it's either, you know, you come and set up, but you have a service industry. So that's number one. Or an opportunity for contract manufacturing. I mean, I'm a pharmacist. When I did my internship a couple of years back, look, multinationals were manufacturing in Kenya, either in themselves as a setup or contract manufacturing. We have a very well-established local pharmaceutical industry. But you find at the current situation, you know, capacity utilization is about 40%. So, and it's because we don't have currently that common market where they can export, number one. Number two is also level of technology, but the pharmaceutical parks will provide that consolidation, because then, you know, you can attract investment for those people who want to do contract manufacturing. And we have a lot of small distributors and wholesalers who actually go out to other countries to get their brands made there and brought into the country. Again, like Jen says, that is exporting. I think it was Rispa. That's exporting labor, you know, so we bring it here. Of course, granted that, you know, with the PPPs, then as private sector, this is where platforms like Kenya Healthcare Federation also come in. Not only are we connecting the investors to the, you know, to the places where they can invest, but also we are advocating for incentives to make the manufacturing locally more attractive. So that's the conversation we are having with the government. But again, if you go to the service delivery side, opportunity for partnership, and this has also been tested and tried in Kenya, in terms of we have limited resources, usually specialized resources. One of our local hospitals to specialize in child health has just partnered with 4 counties, and they're using technology to ensure that the consultants within the hospital can actually, you know, deliver service in a county like in Lamu or Isiolo, wherever. So, and that's working very well. These are the opportunities that you can scale up not only within the country, but also within the continent or within the region. So, and to finish, is just to say that as much as we organize the Kenya Healthcare Federation in Kenya, we have also been able to have, you know, the different countries. Let's say, for example, in the East African space, we have the East African Healthcare Federation, which is made up of, you know, the country federations from 7 countries: Kenya, Uganda, Tanzania, Ethiopia, Rwanda, South Sudan, and Ethiopia. Again, that gives you a very good platform to also, you know, share experiences and also a platform for the private sector in terms of investing in the respective countries. But also in a continental perspective, we have the African Healthcare Federation, which is made up of now the 5 regional federations. So we have one in South, East, Central, North, and Western Africa. So a lot of opportunities, and I think we are, as private sector also, we are really coming together to provide that platform for, you know, optimization or to maximize or to leverage African continental free trade area. Thank you.
Thank you very much, Anastasia. And as you were speaking, I was wondering, I mean, two things came to mind. One was really, which you touched on towards the end, really exporting this sort of blueprint, you know, for what, just the blueprint of, you know, the way you described, one, the structure of KHF as it sits within CAPSA, as it relates to CAPSA, and then building out to the East African Health Federation, and probably also linked to the economic bloc as well. I would argue that, you know, we don't necessarily find such a solid running machine, unfortunately, in some of our African countries for whatever reason. So that I really appreciated. And the second one is also really the opportunity again that these trading agreements presents for us to be able to sort of move capital freely, move resources freely, move ideas freely as well. So, you know, thank you for those insights and for sharing some of the work from the Kenya Health Federation. And so, excuse me, I'll move to Azuka. And Azuka, so now we've sort of really listened to the opportunities presented, of course, in a very broad fashion. Some of the opportunities that are available within AFTCA. So if we successfully operationalize AFTCA, it's obvious, at least to me, from the conversations we've heard so far, that there are opportunities to really strengthen our health infrastructure, to even have an opportunity for different financing models for our domestic resource mobilization, to finance health. So I would like for you to, and given the work that your organization does, and given the growth that your organization has seen in the last, I believe you said 6 years, moving from a project to a full-fledged organization that has provided significant support, particularly in Nigeria. What do you see when you think of the AFTCA, when you think of this other continental approaches to financing healthcare and infrastructure, of course, through the AU? What do you see as the threats to local financing for healthcare and to local financing just for health infrastructure in general? Over to you, Azuka.
Thank you very much. So, it has been an interesting conversation so far, because most times you are in your own silo. I work for an organization that supports governments to invest in health. So we are like top leaders and top partners, trying to get governments to begin to tease out of being so donor dependent, to begin to look at ways to finance health from the public coffers. So that has been a journey, and a tough one. You all understand what that is, where you have so many of our governments, so kind of, I don't want to say irresponsible, but not so much responsible.
You said the word already, it's out.
Yeah, so we've had that journey of trying to bring us back to the table to say, no, okay, you are depending on donors so much for malaria programs, you are depending on the government for vaccine and donors for vaccines, you are depending TB, HIV. Why not now begin to look at the essential medicines program, which is the universal health coverage initiative for the citizens? And we are beginning to see traction in Nigeria, for instance. We now have governments bring out clear budget, not the budget in quote that never is funded, but budget that is actually funded. And they are doing that through the drug management agencies effectively, so strengthening the drug revolving funds. So now, doing that, they are doing a lot of collaboration with the local manufacturers of pharmaceuticals in the country. So there is now the huge dependency on the local manufacturers of pharmaceuticals in Nigeria. That industry itself is immature in terms of meeting the needs for the country. So we have the population and, which is fantastic, but we have to take care of the population. And we don't have adequate local manufacturers to meet the needs, particularly now that we're beginning to see the government say we want to invest. And we, out of 37 states in Nigeria, we just have like 6 states that are now starting this process. And there is a national mandate for every state to take on this. And the manufacturers are not meeting the needs for 6 states. And here comes the AFTCA, and all the manufacturers are looking out. All of a sudden, wow, okay, the doors are going to open. And the government is like, wait a minute, you're not even meeting our needs and you're looking out. What's going to happen? We're convincing the president, we're convincing the National House of Assembly, we're making a case that we want to invest. And Nobody's buying into the universal health coverage mandate. And we're asking you to expand your manufacturing capacity, and you're looking out. So I think for me is that it is an opportunity, but we need to watch that space. Particularly now, we need our governments to become less donor dependent. We saw what happened with COVID. We all keep listening to Strive and the AU team, talking about COVAX and the need to, manufacture in country and in Continental. But the key here is that we need to look at the regulatory. We need to look at the standards of the local manufacturing and their ability to meet citizens' needs. So as we're signing the trade agreement and we're asking for the instruments to drive this trade agreement, we need to look at that part and begin to hold the private sector accountable. How is do you want to look out, but do you have the standards or the regulatory structure? Because we may begin to have another public health issue, which is substandard products going through multiple countries. So for me, there is a need for caution. There is a need for parallel support and strengthening that regulatory space for the local manufacturers. Thank you.
Yeah, no, thank you so much, Azuka, and I think what you're really getting at is sort of a decentralizing of so we now know we're trying to get AMA up and running. So it's really decentralized. How do we ensure that we've decentralized AMA? How do we also decentralize the opportunities that the AFTCA presents? Because, if we can't really, if we only think of AFTCA as, this very monstrous regional body, and as you really pointed out, I think that's very important, if the local manufacturers switch and start looking at AFTCA completely and depend on AFTCA, then governments can't push their national agenda. And you're right, that's where that conflict, we create that conflict. And it may even lead to a disastrous outcome for both, for the regional body and also local as well.
So, sorry, because even the concept of AMA is a threat.
Yes.
Because the moment we mention AMA to the state, remember that at the federal level, a lot of the work at the federal level in many countries are policies, are strategies. The drivers, the implementers are more at the district, at the regions, at the state level. Now, if a state is doing its own AMA in quotes and is beginning to generate funds and is beginning to, oh, wow, I'm making money here. Health is good business, then they have not even recovered, and then we hear AMA and they're like, what does this mean? Are they going to start procuring essential medicines, or are they going to be competing? So they see it as a competition. So the question they ask us, because we kind of guide them to say, this is the global trend. You need to know about this trend. You need to know why you are making your state policies and looking at your plans and strategic plans. Be aware of the trend and be aware of the opportunities. But then the questions start coming, and these are the questions I think we hear. It's critical because in country they see more, particularly for government, more, I think so, the threat than the opportunities. The private sector sees the opportunities, but the government see it for them is a threat. So again, the question is, what would AMA be procuring? Are they going to go into the essential medicine space, or are they going to compete with the donor space, which the government will love it if it's a donor space? You just keep doing what you're doing with vaccines, but essential medicines is money for states. So is AMA going to cut in there? So that these are critical questions that inform policy changes in country.
Yes. No, thank you. I think these are really important things for us to think about, and it brings me back to Jane then, and I'll tweak your question a little bit, Jane, sorry, because given some of the issues that Azuka has raised, when we talk about AFTCA's role in expanding manufacturing, are these issues being considered? Are these concerns coming to the table? You know, preventing a sort of competition between local/national and continental bodies. If you can speak a little bit about that. So really the partnership for manufacturing, that link to AFTCA, and then what are some of the conversations to mitigate the risk of competition between, you know, local and continental? Jane?
Thank you. When I was listening to the conversation, I thought like, I think as ECA or as AUC, basically, because we do the research and we are supposed to communicate and do the advocacy. And I feel like we need, the space is still out there because the AFCFTA is not understood as it's supposed to be. And let me explain what it means. I said earlier on, it's free movement of goods, services, and business people. What it means is that as business people move from one country to another, there's transfer of technology, there's transfer of skills. And let me take as example, I'm a Zimbabwean. Let me take of Zimbabwe, for example. We all know that Zimbabwe is well known for its human capital. And it also has its minerals and its tourism. What AFCFTA means is that Zimbabwe will capitalize on its comparative advantages, do it efficiently, which means Zimbabwe then will concentrate on its human capital. If it's education, then we make sure our schools are going to do better, because with competition, that when the market opens up, those who are not doing well are going to be kicked out. Those who are doing well, those who are not doing so well are going to be kicked out. Those who are doing well, then they're enhanced. So which means Zimbabwe's comparative advantage by nature of who we are, we will naturally focus on minerals or mineral value addition or human capital, or tourism, because of one of the 7 wonders of the world. And we do so well that when anybody hears about visiting in Africa, they will think of, oh, Victoria Falls, because we would have advertised, we'll make sure the hotels and everything there is do so well. When it comes to Cameroon, when it comes to Kenya, for example, they will know the Maasai and then go to Kilimanjaro. When they come to Egypt, they know the pyramids, for example. And when what AFCFTA comes from somebody who is coming outside, you say, oh, when you talk of tourism, I can hop from Egypt to Kenya to Zimbabwe and back. There is now free movement. There's no need of visas. And even internally, as I move as an African, I can move to Egypt, and then so that free movement of people is what will drive trade. The same thing with manufacturing. If I, as a Kenyan, we're manufacturing soap, for example, it means we'll do it so well. Not only that, now do we supply the East Africa, we supply the continent and the rest of the world, because why? AFCFTA comes with the protocols and rules and regulation. And when you talk of if one good that is being agreed with member country is, let's say, manufacturing of soap, they will come up with one standard of manufacturing of soap within the continent, that when a private sector decides to do a soap, wherever they are, whether it's in Cote d'Ivoire, Cape Verde, wherever around the continent, they are following that one standard. That means that good within the continent, it will be treated as a local good. There is no taxes anymore. That's why you're talking free movement of goods and services. If the good that is manufactured in Kenya will go to Egypt and it will have this, it won't have to pay the taxes anymore. It will be treated as a local good. That means it has become competitive. That if America wants to buy that soap, they will have what we call one common tariff for anybody else who is not an African. To then, if you want this soap, you will then pay these taxes. It will make our goods internally competitive, number one. It will also, because of its comprehensiveness, this AFCFTA, it gives everybody space. The government, its role is to create an enabling environment for the private sector. When the AFCFTA is implemented, it opens up this market. Then Mr. So-so, Mr. X with company X will say, I specialize in pharmaceutical production, for example, and I want to do it in Kenya because of its linkages to Uganda, of its linkages to Rwanda, of its linkage to Ethiopia, and if I do it centralized, you essentially have an enabling environment, and it's up to the private sector, and they know how to make money and where to go, and then they'll do that. It's essentially a platform for everybody, the private sector to do what they know best, the government to do what they know best, in creating enabling environment. Now, look at healthcare. It has to be a partnership between the government and the private sector, because there's an essence of where within our communities, there are people who are poor. They cannot afford to buy any medicine. That's where the government gets in to say, we are providing universal care. But for people who are in middle class and going up to the higher income, they want a specialized kind of attention. The private sector then miss that mandate. There is no way, if the AFCFTA is implemented the way it's supposed to be, there is no competition. There is complementarities. It's government doing its part, and we know that government cannot do everything because they don't have money, and then the private sector filling in the gap, and essentially becomes a complete pie. So if there is anything that, if government says there's a competition, it's simply because they don't understand the AFCFTA. They fear that because it allows, you have to let go some of the sovereignty that the government has, which what does that mean? All of a sudden, you're opening your borders. It means the taxes that I was getting with the borders is not there anymore. Then I'm a little bit, constrained in terms of my physical space. But we are also saying the AFCFTA is very comprehensive. It comes with what we call measures to ensure that as you lose out in the short to medium term, we are going to be compensated. So we all have those compensation measures. That's why I'm saying we ought to really educate member states, private sector, civil society to understand what is this framework is all about. Because if we have this misinformation, number one, we don't go anywhere.
Yeah. No, Jane, I think that last point is extremely important. Because I think to Azuka's point, whenever I've heard of the AFTCA really described, it's really it's like we all see and embrace it because we really understand the opportunity. But then it's the practical portion of it for what it means for a government, and you're right, like those sovereign matters, what it means for, the small businesses, what it means for, and as Azuka really spends time on, what it means for the way local manufacturers view AFTCA now and their collaboration in the immediate sense with their governments, right? So I think that's really a good even outcome of this discussion, is really how do we begin to sensitize all these different sectors on what the AFTCA means for them. But on that note, really talking about how different sectors can then capitalize on this, I want to come back to Anastasia. I mean, from what you've heard with Jane's description, or Jane's and I know this was an abbreviated advocacy or an abbreviated sensitization or education of us on AFTCA. What does this mean for the Kenya Health Federation? Like, how has the Kenya Health Federation interacted with AFTCA, and what opportunities do you see for improving investments in health?
Okay, thank you. And yeah, so in terms of sensitization is key, and potentially this is where federations like ourselves come in, because then it is in our interest to ensure that the private sector is educated and sensitized about AFCFTA and the opportunity that it represents. I am not sure how many of our sector players actually, really, until it pains, that's when now they start looking for the information. So the opportunity for Kenya Healthcare Federation is actually to upfront start this messaging, this communication, that there's this opportunity. And the good thing is that we cut across all the subsectors in health, and we have the opportunity to partner with the different partners. Now, one of the things also we're doing, and I'm glad that Jen is here, we're working very closely with the Sdg Partnership platform, specifically for us, the health window, but through KEPSA, the entire Sdg Partnership platform. And this one is one that brings the private sector, the government, and the funders, and also the UNs. It's a platform that basically really looks at what are those bankable opportunities. And this is where we are pitching some of our investments. As KHF, from an advocacy perspective, but also pulling our members, tell them that there's this opportunity. I don't know if you've heard about the financial, it's called FinTrinet, Finance, Trade, and Investment Network. that has been put together to, by the UN, and the CAPSA Foundation and the government to consolidate and to look for those people or organizational, those projects that need to be funded. And then they will be able to connect the funders with those opportunities within the country. And this is something that CAPSA launched, I think in July this year. It's up and running. THF, we are very much plugged in, and we have some 2 opportunities. We're looking at how do we drive those. So for me, very important, the sensitization, the education, because at the moment, it's business as usual until now, things start turning around. So that's what I would say. So yeah, the federations have to play a role in ensuring that their members see the opportunities and they see that actually things are going to change. And so it cannot be business as usual, it has to be business as usual. And with the time to prepare is now. Thank you.
Absolutely. And so fully agreed with you. And so Rispa, now coming to you, in the beginning, I mentioned that, one of the things that's quite unfortunate is that, we assume the health workforce will be there, and we assume that we'll have the entire spectrum of the health force, right? Doctors, nurses, pharmacists, lab technicians, community health workers, epidemiologists. We just assume, but we see. I found there's a number Dr. Kengasong always talks about when referring to the new public health order and strengthening Africa's public health workforce. And he says, we on the continent, we only have about 1,900 epidemiologists. We need about 6,000, and even 6,000 is quite small. And so just to think of that with all the outbreaks, disease outbreaks that we see, now a pandemic, 1,900 is barely a drop in the bucket, but we don't raise these issues. We look at the community health worker. I won't even call it a labor force, because in most countries, it's not a formal labor force, right? I think there are only 3 countries, Ethiopia, South Africa, and Rwanda. But there are other countries such as Kenya that are making really big strides in formalizing that workforce. And they're needed more than ever for task shifting, to even train them as vaccinators so they can reach, a lot of the underserved areas. So what is it that we need to do? What are those strategic investments in the health workforce that need to happen now? What should we be thinking about? What are the influences? What are the conversations you're hearing?
Yeah, and I think it's funny that you mentioned that number, because I think that's John's favorite number to keep rehashing wherever he goes.
I think he wants all of us to have it like printed on our
Yes, you should have it at the back of your hand, like 6,000. The number is 6,000. No, but I think that's really critical, because when you look at the full spectrum of healthcare workers, I think we often default to doctors, nurses, whether it's clinical officers or paramedics. We forget that in terms of a pandemic, you actually also need epidemiologists, you need lab technologists, you need public health informatics teams. So you need a really big spectrum of people who are involved in this process. But just looking at the bigger, health workforce and looking at the public health workforce needs, I think the first thing we need to do is start to rethink how we actually measure performance around healthcare workers, because we assume that healthcare workers, are supposed to give us maximum outputs, but we give them minimum inputs. So if you're going to measure a healthcare worker based off of what they have access to in terms of resources to deliver on a particular service, then you should not ask them to, if they don't have access to medication, for instance, yet you want them to deliver on vaccines, or they only have one BP machine to be able to measure blood pressure, but they have to measure 500 people at the same time. So that means that their productivity in that sense is much lower. But then there are also all these other factors that look at the motivation around healthcare workers in terms of all these push and pull factors that we've been talking for, I think, more than one decade, right? Looking at what exactly influences healthcare workers to either forego the profession of in the healthcare workforce, or actually migrate to somewhere else, where they typically call it greener pastures. So that means we're competing with not just local forces, we're competing with global forces, because that means policies, for instance, in France or the UK actually influence, access to a healthcare workforce in our own countries in Africa. So what does that mean for us? I think the first thing we need to do is also just figure out how we measure successful healthcare workers and recognize that they go above and beyond the call of duty to be able to deliver on services, whether it's in the context of a pandemic, without going into, I usually say going into the darkness without knowledge, without, and just giving it their all. But then in terms of what direct investments can be made, and I think these are the ones that I would focus on for state actors, and of course, non-state actors can also play a role in this, is really looking at how we plan and project for our needs for the health workforce. So now that we have this number, for instance, on epidemiologists, for instance, what does it take us to get from 1,800 to 6,000? Is that something that we can do in 1 year? Is that something that we will need to do in 6 years? And then even utilizing what we've been talking about, the Africa Continental Free Trade Agreement, does that mean that we only want to cater for 500 epidemiologists in Kenya? Or do we want to make sure that we train across the continent and we make sure that they can actually move freely across the continent, and you give an attractive reimbursement model for people to go into that field, because they don't have to, they will be an actually continental healthcare worker. And that's how we need to really think through the public health workforce. I think we need to look at it as our African public health workforce, because we've often looked at it as, state actors. And remember, the key driver of efficiency for a healthcare system is actually a healthcare worker, because they determine how the resources are used, they determine the planning, they determine the actual delivery of services. And that's one of the things that I would just want to mention. I know we don't have much time, but really, and then looking at how we also empower leadership, even female leadership amongst healthcare workers in the continent. How do you strengthen that personal development? How do we look beyond our borders and see, how do I make sure that I'm giving the best that I can for my healthcare workers? And part of that conversation is definitely commodity security, discussing inputs, discussing defragmenting our healthcare systems. But the other part is also looking at how we incentivize our healthcare workers. And we really need to think through different incentives and really break those borders we have in our minds, because priorities are shifting, especially in the context of universal health coverage and in the context of a pandemic. And then finally, I would just also say we need to also have a mindset shift to go back to that, focus on self-reliance and self-sustain, like just looking at how we can sustain ourselves as a continent and also as our individual countries. The finances really should come from ourselves in collaboration, of course, with private sector. Yes, so that's kind of like my summary and my time on the soapbox. Thanks.
A great time on the soapbox. Thank you, Rispa. Unfortunately, we are at the end of our conversation. I mean, we just scratched it. So it would be great to have an opportunity to really expand this conversation. And so just for us to wrap up, I'll give each of you just 15 seconds. And my question is, even if it's something you've said already, what do you think we have to do now to influence investments in health? Just one thing. I'll start with you, Dr. Anastasia.
Yeah, thank you, Lauren, and thank you for this opportunity to participate and share the insights. I think the one thing that we must do, especially from a private sector perspective, is to strengthen public-private collaborations. I think it's very key. We've just had the government has the ideas, but they may not have the money. Private sector has the money, but it has to be aligned with the government policy and investment area. So really, public-private collaborations are key, and that is what we must actually, foster going forward, so that also we can identify these opportunities and drive them to the next level, and also walk the journey and walk it as soon as yesterday, not waiting for time to come. So speed is of essence, but let's really strengthen the public-private collaborations. Thank you.
Thank you. Azuka?
Responsible governance. Responsible governance.
Fantastic. I like that. Jane?
Thank you. Thank you for the opportunity. On my part, I think its implementation of the AFCFTA is such a comprehensive frameworks that speaks to private sector, that speaks to the government, that speaks to civil society, that speaks to the people. Everybody has a piece of, it's a big cake that everybody has a piece of it. If we can only implement, and then implementation takes money, so development takes money. And there is nowhere in this world where any country has ever developed depending on outside the development partners. We have to champion our own development agenda. We have to look internally for domestic resource mobilization, whether it's innovative ways of doing that internally, and we have it. If we can have confidence in that we can finance our own development and then implement it and monitor it, and they have the data, because if for policy making and implementation needs data, and keep that data and track it, we can get to the Africa we can be who we want as a people, as we do what we're supposed to be. Let us be responsible that if one of us has a part, each one of us, even you and I, have a part to do this, and let us all do our part, and the Africa we want will be realized. We can leave a legacy for you. We won't have to have these issues that we have had where we have supply chains because we can only manufacture, where a continent can only manufacture 2% of its pharmaceuticals, 1% of its vaccines, and then you say, oh, why is everybody else feeding their own self first without doing that ourselves? We ought to be ashamed of ourselves because we don't champion our own agenda. If we don't do that, somebody else will. And let us now change that dynamics and say enough is enough, no more of this, no more of this. From today forth, you and I are going to do our own respective way to do what we need to do for the Africa where we want. Thank you.
Thank you very much, Jane. Rispa?
I don't have much to add to the lovely ladies here. I think for me, it's really just to say just get started. Break down those silos, whether it's through public-private partnerships, whether it's even through intergovernmental collaboration, where you're having different ministries sit on the table to actually plan for this. Trade is something, when you look at it from the healthcare perspective, it's something that is actually influenced by different ministries, for instance. And we saw that in COVID. And I think we need to build on all those strengths we were developing, how quickly and swiftly, it was almost with surgical precision that we were able to effect some of these things. Let's carry that forward and let's just keep going, because I think let's not lose that momentum that we had during the immediate emergency. Let's carry that forward and also carry that forward in terms of human resources for health, because I think they're really critical in terms of making sure we have effective delivery of healthcare services. Thank you.
And with that, I thank all of you. Thank you for your time today. Thank you for sharing so much with us and for all your insights. Really, really informative. And hopefully we'll have an opportunity to continue the discussion. Big thanks to the organizers, and we certainly appreciate this conversation. Thank you and have a fantastic day.